Welcome to the Business of Medicine podcast from the Southern Medical Association. Since 1906, SMA has had a singular mission to provide medical professionals with the resources they need to learn from each other and in doing so improve the overall quality of patient care. The Business of Medicine podcast is dedicated to exploring and simplifying the varied and complex business aspects of running a medical practice so that you can do what you do best, provide your patients with the highest possible standard of care. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
This is our second out of 3 series on Kaizen. Thank you, Dr. Migita, to be with us today. And as what we did last time with Kaizen number 1, I have a number of questions that I would like to go through and get your thought on that. And at the end, if there is anything that you would like to tell our audience, please do so. Without further ado, my first question is, some people may ask, we have always done it this way, and it worked. Why do we need to change?
We hear this a lot, and it's a question that I think is relatively easy to answer in the context of the status quo. So the status quo really represents what's comfortable to somebody. It's something they do day in and day out. It's predictable. It gives them a sense of relief. But the danger is that this status quo often represents a state of no improvement. It's like the Dark Ages in Europe. So ask yourself, is the care that your patients are getting right now, is that the best it can possibly be? And if you think it is, then show the results that you have, and show me that you have no room for improvement. And I would say, somewhat uncontroversially, I think that no hospital can say there is no room for improvement.
Very good point. So, if an organization like Seattle Children, where you work, have already figured out the answers, some may ask this question: why can't we just implement their solution to our certain problem without doing the whole project all over again?
Well, anyone who's done TPS and practiced quality improvement science will tell you that they've just started. Any of our top leaders here who had the vision to employ this methodology here at Seattle Children's will tell you that we've just begun. Toyota would tell you the same thing. They've been at it for 60 plus years. And, supposedly the best person at anything, whether it's sports and industry or any profession, they will always tell you that they haven't perfected their craft. And borrowing good ideas from other areas, it's always okay. But your workplace, your gemba, it's a Japanese term for where the work is done. Your gemba, your people's skill levels, your people's mindsets, they're all different. You can transfer the tools we use here at Seattle Children's to another place, another hospital, another clinic, but that doesn't build a culture of change. A culture is really what your institutional memory will be. It's the culture. You're proving it for the generation that follows you, and that's really your goal.
So some may ask, okay, we're going to do this, but how do we know where to start?
It's a great question. I get this. Probably the number one question I get, and again, I'll answer that question with a question, a very simple one. And my Sensei Nakamura would say, "Well, what do you want? What do you want?" You see, because what you want is your gap. What you want is your goal, and you have to be very, very thoughtful about this question. And how many people actually know what they want? If you go and ask people, stop anyone, hey, what do you want? They'll often pause and look at you with a sort of inquisitive look, as if you're asking them a very strange question. But leaders need to understand that the people below them will struggle if the leader does not know what he or she wants. And the organization itself won't flourish. It won't be successful. It won't be innovative without knowing this. So I would say to that person, tell me what your biggest problem is. Tell me what people around you can't stand existing, a problem they just want to get rid of so badly. That's where you start. it starts with the question, what do you want?
So with every project that you want to do, you need to get commitment from people within your organization. So how do we get commitment from everyone for this?
Well, what I see a lot is people say, I'm really busy. There's no way I can do my regular job and I can't commit to this. I'm already too busy. And what I would say is I'd say the first thing people need to realize is the majority of what they do is waste. And that phrase often rubs people the wrong way, but I can only apologize and say I'm sorry, but it's true. And you need to recognize that. Leaders should be in the workplace. They should not be behind a desk or in a conference room. They should be down in the workplace, giving their people a chance to escalate problems to you. Your job as a leader is to set the goals and help your people implement their ideas. So good managers, good directors, great CEOs, great senior vice presidents live in the workplace. So you need to ask yourself whether you're a leader of a small team or a leader of a large team or a leader of an organization, are you going to the workplace? Or are you making time in your schedule to actually be on the front line? You're never too busy to improve. That really is an excuse.
So you need to get everybody involved. And sometimes we get this question, we really want to help out, but our department is understaffed. Can we opt out of Kaizen work?
We're all understaffed. And the question goes back to the answer to this question goes back to the last one. And you always have to keep your eye on people overburdening them with too many ideas. But if you really break down someone's work, there is a high likelihood that more than 90 or 95% of what people are doing is really not value added to the patient. So the first step in addressing this issue of being understaffed is to eliminate the work that people do that is not actually benefiting the patient. So the very first Kaizen projects or change projects, whatever you want to call them, should be ones where people look to get rid of their non-value added work. And this is going to give them time to do Kaizen, to actually meet their goals. Toyota will look at a process and say they're driving a rivet into a piece of sheet metal. Toyota would only count that precise moment when the hammer actually strikes the rivet as value added. So they're getting down to shaving seconds off of their times. But think about your day. How many meetings do you go to that are not important? How many phone calls are you on that really had no value? How many emails do you send and receive that have absolutely no value? If you take away all that non-value added work, you have time to improve.
So in your talk, in your podcast about Lean, one of the things you mentioned was Lean is about waste reduction. So the question is, moving the garbage can, telephone, fax machine, suppliers, etc., closer isn't really going to make that much of a difference, is it?
Right. Yeah, I hear this. Why does a small change make a difference? Well, think about the additive effect. So say I was working on a project that was able to shave 10 minutes off my day, getting rid of 10 minutes of value added time. So if you do the math, that's 2.5 days that I've saved per year. So say I share this time savings with, say 10 other people. So that's 500 to 800 hours a year that I've saved now collectively. So what could the organization do with 600 extra hours? Well, they can improve. So small change leads to big change. Taiichi Ohno would say this, and he would actually is a direct quote from him. He said, "If small change leads to big change, you would be stupid not to do small change." And that really is the heart of PDC and TPS.
So some may say, I really enjoy walking to that garbage can, telephone, fax machine supplier's room, and it doesn't really take
right.
much of a time.
Right. Well, you have free time. So if you enjoy making that walk, then use it to analyze the problem, use it to think, use it to plan. Waste detracts from your quality of life. Waste detracts from the amount of time you have in your lifetime to create and innovate and achieve. And, time is the one thing, Reza. Time is the one thing you never get back time ever. That's why time is so important. You can lose money. You can lose, your material possessions, but you can regain those things. But you don't get time back. You don't ever get time back, ever. So use that time wisely.
We're all human. They said, they asked question, defect will happen because we're all human. It's futile to set the target at 0.
So are you asking, is it somehow futile to set the target at 0? Yeah. Is 0 too low? Is that traffic? We hear this. I hear this. I even fall into the trap of thinking this myself, but 0 is the ultimate goal. It is always the ultimate goal. The vision is essentially unattainable. Toyota's vision of just in time is actually an unattainable goal. 0 harm is an unattainable goal. 100% profitability is the ultimate goal. If you were a patient, what do you want the goal to be? Do you want the goal to be a 10% line infection rate? 5%? I want it to be 0. So airlines don't aim for, a 1% crash rate. That's pretty obvious why. Airbags, when you get in a collision, they have one chance to work in that collision. One. They might have one chance. So setting the target at 0 is the responsible thing to do.
Now, going back to the same question, kind of similar question we had in our first Kaizen talk, was why should we celebrate defects? Our patient won't trust us. This is not car manufacturing.
Oh, I would not underestimate a patient. I think if patients see that you are invested in improving, that you as a caregiver or us as caregivers suffer from the mistakes that we make, and that we don't hide them and we learn from them. When they see that vulnerability in us, when we've harmed, and they see that honesty, I think they trust us more. I think patients, families, they know we're not perfect. It is far worse to ignore the defects than it is to make them visible.
So in a hospital setting, the only way we're going to see more patients, do more surgery, more procedures, run more labs, is to change our hours. That would be one argument.
Oh, to increase time. Yeah, to increase time at work. Well, this gets back to waste reduction. And when you eliminate waste and you're committed to it and able to see that the work you do, your status quo, which is hard to let go of, you'll discover how much time you actually really have. And it is difficult to let go of what you know. I wouldn't say that's not true. That's universal. But when the waste becomes comfortable, when the waste becomes secure, when the waste becomes something you don't want to change, well, that is the perfect recipe for the status quo. It's the perfect recipe for a state of no improvement. So this is not about increasing hours. This is about using the hours you have in the most efficient way possible, with the least amount of effort and the most amount of gain for our patients, and for ourselves in our job satisfaction.
Some people at the hospital say, you know what, we already have too many metrics. We don't need any more. So how do we go about that?
Yeah, you bring up a great point about prioritization, and that may certainly be true. If you look at a hospital dashboard, there may be too many metrics there, and you have to take a long-term view. You have to think about what my sensei would say, baby steps, one step at a time, one day at a time, a few improvements at a time, but an improvement cycle that continuously runs. When you get the small wins, when you break down the big goal into smaller goals, you'll get these wins one step at a time. So leaders need to understand the long-term vision. They need to understand the stepwise process of getting to that vision, and they need to prioritize what's important right now. When you are able to list 10 steps to a quality goal for your staff and are able to say with confidence as their leader, this one first, this will bring a sense of relief to your team. They'll know what's important at that time. So if you're a leader, you must know what to work on first. And the only way to know that is to be on the front line. You need to understand how the work is accomplished, and that cannot be done from your office.
So some may argue, the only metric that matters is our monthly patient satisfaction survey.
Well, that's one. That's one metric. Remember those pillars of quality, cost delivery, safety, engagement, productivity. These are all going to contribute to the ultimate aim of the institution. And it is no harm, but the simple financial reality is that profitability is the ultimate aim of the institution. Without profitability, we do not exist here in this hospital or anyone else. Without profitability, we cannot deliver healthcare to the patients. We cannot save lives. So we care about profitability, right? We care about that. So if we care about that, we care about patient satisfaction. We care about quality. We care about delivery. We care about safety. We care about engagement. We care about all those things.
All right, we're too busy. A daily huddle at the same time will never happen.
The huddle. Right, people have become somewhat huddle happy.
Yeah.
Even in every institution, and they're well-meaning huddles. But will a huddle happen at the same time every time? Well, tell me this: if the huddle is important, if people show up to a huddle with a notebook and write down what it is they're going to do, what actions they're going to take that day, the huddle changes their action for the day, then they'll show up every time. If you can walk away from a huddle and remember what was said, then it was important. If your huddle drives action, your huddle will happen at the same time every day or every week. If people want it to happen because it's moving things forward, it will happen. So it's not so much having a daily huddle, it's the content of that huddle and what that huddle drives.
All right, we're doing some metric in our department, but the numbers aren't really good. I'm not going to be hanging up any of those on the wall.
All right. It's again facing your vulnerability, facing what people may think is failure. But do you know anybody who doesn't actually want to achieve things? If I don't really know anyone who doesn't want to achieve things. If the leaders don't make the teams post the results, even their failures, then that tells me that leader wants to hide the problems. And when you hide problems, people get hurt. So not good enough? Well, that is the nature of PDCA. That's the nature of TPS. It's the nature of how healthcare organizations should be run. It should never be good enough. It can always be better. And it starts with not hiding problems.
One of the things that I hear a lot is that you can't cross-train in healthcare.
You can't cross-train in healthcare. There's two systems of that I think about when I think about how any organization can be run. One is a very regimented division of what I call division of labor system, where everyone has their task and they move the task from one area to another, and that person only knows that one task. And this is the perfect setup for blame. And we see this in hospitals. The inpatient unit blames the ER for not working up the patient enough. The outpatient physicians blame the inpatient physicians for not communicating the plan of care or notifying them that their patient was hospitalized, et cetera. We see this on a more micro level too. So if we're creating a clinical standard work pathway, I have workers that do various aspects of the production process. If they can learn the tasks one step up from their task and one step before their task, then they've been cross-trained. Now, when they understand those tasks, both the preceding and the proceeding task, they have now they're much more motivated to improve all steps of that process. So when you cross-train people in this manner, you have a greater control over really your timelines and flow. When you cross-train, you're creating workers that are multi-skilled, and these are your future leaders. So this is a very powerful thing in healthcare to cross-train. Now, could I as a physician also learn the tasks of nursing? What if I could? Could I set up the med faster? What if the nurses became more trained in making actual medical decisions for patients? Would they have to wait for our decisions? This is an expression of really the great potential that every human has to learn more skills, to not rely on the division of labor.
So when we talk about attack time, we're talking about the industry. Now, in healthcare, some may argue attack time doesn't really apply to us because we're open 24-hour a day.
We are open 24 hours a day, but timeliness is a pillar of quality. It's a pillar of quality. Decreased lead times leads to better outcomes. When a patient is septic, has an uncontrolled infection, the faster you get the antibiotics into that patient, the faster you get intravenous fluids into that patient, the more lives you save, the more harm you reduce. So again, this gets back to the concept you never get time back. So if you were a patient, do you want to wait? Of course you don't want to wait. So if you ask yourself what the customer, what the patient needs, you'll know what to do. Attack time applies to you, and anyone involved with the care of a patient can't make this excuse. They can't make this excuse.
What if we say, we don't have any problem in our department, so we don't want to do any Kaizen here?
I'll quote Taiichi Ohno again. He said, the biggest problem of all is having no problems. So if you have no problems, you're hiding problems. If you supposedly have no problems, then you've reached a state that no one has ever attained, to never have a problem. You're just simply hiding them.
Who do we benchmark our result against?
You can benchmark in a lot of ways. You can benchmark against yourself, your own institution. In healthcare, there's the FIS databases, Solutions for Patient Safety, SPS, the U.S. News and World Report, just to name a few, Leapfrog, et cetera. However you benchmark, it may not be as important as the concept that you never stop measuring. My sensei Nakamura would say you never stop measuring your progress. Never stop measuring the impact of your changes. You need to measure the changes your improvements are making or not making, and make these visible to your staff. This is what keeps this energy of change moving. You need to show people, perhaps those folks that are not engaged with change or Kaizen, you need to show them that people who are engaged in Kaizen and change can create change, meaningful change, improvements. Put these wins in front of the people, and other people will join. So benchmarking is important for a number of reasons.
So some may argue, that all of my work is 100% value added, and all of it is necessary.
All of it feels necessary. All of it feels necessary, and this is, I think, a motif in the answers I've given today, is that there is so much non-value added work that we do, and I would say this to people who I would say go out a day, in one day, maybe every day in 1 week, and challenge yourself to find one thing that's not value added to your day, even if it's tiny, even if it's small. I will guarantee you that you will find more things that are non-value added, and you'll become somewhat, I don't want to say crazed, but very enamored with this concept of getting rid of it. Why do you want to get rid of it? You want to get rid of it so you can do the things you really want to do, so you can innovate, so you can think, so you can spend time with the patients and families. How do you want to spend your time? You want to spend your time looking for things? Do you want to spend your time walking endless, traveling from one place to another? Do you want to spend time searching for things? Do you want to do those things? Of course not. So that's non-value added work. You need to look to decrease that in your life.
So what if the personnel is a frontline worker? It said, the value stream map is for the manager, not for me.
We do hear this, and my answer is really simple. Why wouldn't you want the front line to see how important they are to the institution? If you're going to create a value stream map that shows the connections of all your various departments, clinical, non-clinical, ancillary services, they see where they fit on that map. Why do you not want to show them that they're important? Of course you do. The value stream map is for everyone. It gives everyone purpose. It shows that everyone is working towards a common goal.
So one of the challenges is that, you'll never get people to speak up when there's something wrong, because if someone has stopped the line, like, we say in Toyota production system, now in healthcare, somebody has stopped the line, the lab or our clinic, they got into trouble. And nobody wants to speak about that.
Mm-hmm. It's a great point. It's a great observation. And stopping the line it is about reducing errors, but it's really about empowering people. It's not about punishment. It ought not to be about punishment. And leaders that understand that truly understand TPS would never make it a punishment. Stopping the line is a chance to solve the problem that's in front of you right now. Stopping the line and responding to that stoppage is honoring that person who stopped the line. You're honoring them by helping them solve the problem. This is what Toyota would say is respect for people. You're looking to have really a shallow authority gradient. That's what you want in hospitals. And this gets back to the idea of a goal. If the goal is clear, say, for example, to prevent harm, then people are going to speak up when they see something is wrong. So TPS would dictate if they find that solution, then that would become the new standard practice. So stopping the line is essential to improvement, not just improvement in the moment, but improvement that continues after that time, improvement that's continuous.
So why don't we just hire more people?
You can always hire more people, and hiring people is important, obviously, because you want as much skill set as you can in the workforce. But usually hiring more people as a solution to an issue is usually a waste. It's usually wasteful. If a given task takes 3 people to do, you should try to do that with 2 people. And the goal is not to eliminate the job, which often people jump to. They say, oh, well, if you're trying to go from 3 people to 2 people, you're actually trying to get rid of workforce. Well, that's not true. If you free one whole person up because you found a more efficient way to do something, that person can be freed up to do something more important. Or maybe that person can be the next trainer if they're an expert in that process. So this is not about job cutting. It's not about just blindly hiring more people. It's about being more efficient.
Does Kaizen mean that we will downsize our staff?
No, not at all. For the reasons I stated, when you become more efficient in the process and need less people to do a certain process, whatever that is, and you're concentrating on cross training, there's a concept in Toyota called an internal consultant, and these are frontline workers who have broad skill sets. They are not downsized, or the people who maybe don't have as high level training are not removed. You find your best workers and you make them the trainers, and you create a system of internal consulting that drives improvement.
Some people may say, I don't feel really comfortable. Some people on the nursing unit, in the lab, in the OR, I'll do the Kaizen from my office.
Right. There's a saying that Kaizen starts with you. It has a lot of different meanings. If you stay in your office and your worker, your people do not see you doing change, do not see you pushing forward, failing, getting back on their feet and trying it again. If they don't see this, they don't see you pushing forward at all times to fail and learn and improve, then you will not have change in your organization. So you need to get over the discomfort of your office. You need to get over that fear and get out into the front line and show your staff that you're able to change things, and they will follow you.
There have been times people talk to me and say, I have ideas. I have good ideas that I think projects that I can do, but I'm always afraid if these ideas and projects fails or get poor outcomes.
Failure is fantastic. Failure means you're trying. If you failed, you've learned something important. Name me one great thing that was accomplished or achieved without failing first. So you have to use failure. You can't be used by failure. Failure is a tool. Failure shows that you're trying. Don't be afraid of failure. I mean, it's a cliche, but it's so true in a system that understands PDCA.
What if you can't 5S this area? We need absolutely everything just in case, because patient lives are on the line.
Oh, I've heard this. How much time do you want to spend searching for things? I open a code cart. I need everything to be where I anticipate that it's going to be. If I need an emergent blood transfusion, I know exactly where that O negative fridge is. I know where it is. I don't want to spend time searching. I want things in place. Standard work cannot happen without an area first being 5S'd. So there's a very intimate connection between 5S'ing the workplace and the ability to do just-in-time and standard work. Those two things go directly together. Most people see them as separate, but they're not. They're the same thing. They require each other.
So what if you ran out of something and the person got into trouble? I think, they'd say it's okay to have 100, 500, thousands of those items on hand because we ran out of one item last time and we got into trouble.
There's inventory that is set at a par level, so just what you need based on what you know the demand to be, and there's waste. If you have too much of something, 500 of anything is likely to be waste. The more waste, the more inventory you have, the more floor space you need to store that inventory, which costs money. The more inventory you have, the harder it is to find what you're looking for. Inventory hides problems. It's really one of the pillars of the Toyota production system, which is just in time, but it applies in hospital settings as well. You need only what you need in the right place at the right time. You do not need 1,000 of everything. It's very expensive. Think about drugs. If you have too many drugs in the shelf in pharmacy, what happens? They expire and you throw them away. That's waste. It's cost.
So if you want to track these, so it will take too long to see who uses which supply in the department and to get consensus on where to store them. I'm the boss. I want to make an executive decision.
There's a place for both in TPS or any organization that I consider to be well run. Is that the goals are top down. The leader sets a direction, leader sets the tone, leader sets the direction, leader sets the priorities. The solutions are bottom up. And there's this concept of catchball, which we can talking about in another podcast. You must play catchball. Leaders set the goal. Those trickle down to the subordinates. They think about ways to solve these problems, and they play catchball with the goal. If you do this correctly, you will unleash potential of basically every member of your staff. So it can't all be top-down. There is a top-down, bottom-up catchball sessions that you play at multiple levels. You can even schedule these catchball sessions over the course of the year to achieve your targets. And this, again, gets into the concepts of Hoshin Conry or policy deployment that we can talk about in another talk as well.
So if our egg system was electric, we wouldn't have this problem.
Oh, you mean electronic?
Yeah.
Yeah, I see. When you think about how to do improvement, there are three big buckets that you must address. There's the mindset, which we've talked about, the need, the will to change, the process, which we have not talked much about, but that's standard work. That's tying processes together. That's optimizing the steps in a process. And then finally, there's technology. So how can you take your processes and apply technology to spread the effect over a broader area in your institution? So mindset, process, and technology. And technology comes last. You must have all three of these pieces in place to sustain improvement. But technology is the final piece, and it really should. One of my former mentors, Pat Hagen, used to say, do it on paper first. Do it on paper first, perfect it on paper, then use technology. Nothing can be more true. It saves you a lot of time thinking about it that way.
So some may ask, why do we need to get patients' voice? We already know what's best for them and what they need.
So they're our customer. Do we know what's best for them? Well, what do we know? we know they don't want to be hurt. We know they want us to truly care about what happens to them, and we know that they want to be cured from their disease. These are the basic things that we know, but how can we really know what they want unless you ask them? You must ask them.
So my final question is, we've got our people. We've got our IT, our accounting, our statisticians, data scientists. They're collecting our data. Why do I have to do that?
Who's the closest to the front line? Where is value created? Value is created. You get closer to the value when you get closer to the patient. The closer you are to the patient, the closer you are to the front line. So if you're the closest to the front line, you know what data you need. So they will know the work, and they'll know what data is the right data. In our CSW pathways, we bring our data analysts and our frontline clinicians together very early in our process when we create our pathways. We do it for this reason. So the two arms, two very important arms, are working together from the beginning, but you need that connection to the front line. So this is this concept of don't subcontract it, don't subcontract out what's truly important. You must build teams that make sense, and you must work together.
Thank you again, Dr. Migita, for coming on board for our second out of 3 series on Kaizen. We look forward to having you again for our third and final series on Kaizen on our next podcast at Southern Medical Association.
Thank you so much.
We hope you enjoyed the business of medicine. For more episodes in this series or SMA's The Practice of Medicine podcast, go to sma.org/podcasts or subscribe to us on iTunes, Google Play, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit us at sma.org, and thank you for joining us.